President Obama promised us that our healthcare premiums would fall under Obamacare, but they're not. They're skyrocketing under the so-called Affordable Care Act. What a misnomer. But Hillary doesn't think we should repeal it. She wants to build on it. Like I said, hang on to your wallets, folks. Let's take a look at the Democrats squabbling over healthcare.
Things we can do to improve it, but to tear it up and start over again, pushing our country back into that kind of a contentious debate, I think is the wrong direction.
I have to talk about something that's actually working in our state.
No one is tearing this up. We're going to go forward. But what the Secretary neglected to mention, not just the 29 million still have no health insurance, that even more are underinsured with huge co-payments and deductibles. Tell me why we are spending almost 3 times more than the British, who guarantee health care to all of their people.
Maybe we shouldn't have tried to destroy something that was broken. Maybe we should have just improved our system. Under Obamacare, health insurance premiums on the individual marketplace are rising by double digits in most states. 17 states face an average increase in premiums by 20% or more. For instance, Iowans, your premiums will spike 22% this year. Minnesota, Alaska, Tennessee, Hawaii, your rates are going up by 30%. If you want to see it for yourself, go to freedompartners.org and check out their 2016 Obamacare Premium Increase Tracker. Now, I'd like to welcome back to the program medical expert and author of Losing Our Way in Healthcare, The Impact of Reform, Dr. Kevin Campbell. Great to see you again, Dr. Campbell.
Good to see you. Thanks so much for having me.
These healthcare premiums in a lot of states are shooting up by double digits, Doctor. Is that what Obama promised?
You know, he promised affordable health care for everyone. And really, when I talk to my patients, it's not affordable because they can't make copays. Their premiums are going up. So even if they are insured, they can't use the insurance because they can't afford the deductible.
Now, Hillary Clinton said in the debate on Sunday that she didn't want to repeal Obamacare. She wanted to build on it. How do you build on a disaster without making it worse?
I agree with you. You know, I think we're going to come to a crossroads. We're either going to have to repeal Obamacare or we're going to have to bail it out like we did with the banks several years ago, which is going to be throwing more good money after bad.
What did she mean, do you think, when she said that she wanted to make adjustments, that the issues were just glitches?
You know, I think that just shows us she has no plan. She's just using these as talking points that she wants to do this, that, or the other thing with no clear plan whatsoever. If you're going to make changes to Obamacare, you have to absolutely understand the problems and then go forward with, you know, affordable solutions.
Right, and I think her solution is government takeover. She's not even looking for things that will benefit the consumers, benefit doctors and patients in that relationship, quality of care. She's just looking for more ways that the government can grab a hold of power. Congress repealed Obamacare, but Obama vetoed it. We expected that. But there wasn't a single question about GOP alternatives to Obamacare in the last GOP debate. Why don't Republicans and doctors talk more about what better ways we have to solve the issues in our healthcare system?
You know, I was really hoping that we'd see more discussion over healthcare in the last debate. You know, I think physicians now are really advocating for patients, and certainly, as I discuss in my book, there's lots of potential solutions. But I think we have to really pressure our Republican candidates to address this issue because this has to be fixed in the next administration.
All right, now, I was analyzing this a little bit, and I think there are 3 main things, 3 aspects of Obamacare that are wrong, that are troubling to the American people, if you will. And I want to go down this list of 3 things, and I want to ask you what a better solution to each of these elements is, a practical solution, so that we can give the GOP candidates an example of how to talk about alternatives to Obamacare in the practical sense. So the first issue that I think really bothered the American people about Obamacare is that it's government taking control of a private industry, and this dilutes our freedom. So what's a better way, in your opinion, to address this in a way that increases our freedom and our quality of care?
You know, one thing that Obamacare doesn't give us is choice because the reimbursement rates are so low. So many institutions and groups of doctors aren't able to afford to accept the exchanges. Many insurance companies, such as United Healthcare, that just lost $720 million last year on the exchanges, are pulling out. We've got to figure a way to fairly compensate physicians, hospitals, insurers, and at the same time deliver quality care. It can't just be one way.
Right, and the second thing I think that bothers the American people is that what you just said, that causes government to sit in between doctors and their patients. That lowers the quality of care, and that makes individuals, even myself, when I go to the doctor, feel like government is the third person in the room, which is just creepy. What's a practical solution to that?
You know, we have to get government out of the exam room. The doctor-patient relationship is sacred. The exam room is one of the most sacred places in all of medicine because what's said there is private. Well, now the government tells me what I have to ask, what I have to type in the electronic medical record. With the recent executive action on gun control, I'm actually told that if I suspect mental illness, I have to report that to the FBI. That's not the place government needs to be.
No, that's clearly a violation of our privacy. Now, the third bullet point that I had written down, that's the amount of money that it costs us. Is it necessary for healthcare to cost us the amount that it does and still maintain this quality of care without really improving or increasing?
So here's the issue. Obamacare addresses a lot of the costs, but it forgets a couple of things. It forgets tort reform and limiting malpractice claims because that really drives up the cost of care. The other thing that it does not address is the cost of prescription drugs. If you go to Canada and get a prescription drug by name brand, it is substantially cheaper than it is here. So the U.S. seems to bear the burden of research and development for pharmaceuticals all over the world. We need to share that cost so that our costs decrease.
All right. Now, in the debate last weekend, Bernie Sanders said that he doesn't want to do away with Obamacare, but he wants to implement Medicare for all. We have a video of him saying that, so let's take a look.
But after pressure from Hillary Clinton,
he hasn't yet told anybody how he would pay for them.
And conveniently, just hours before the Democratic debate, Sanders released his plan to pay for Medicare expansion. He estimates the cost at $1.38 trillion per year, slightly lower than an estimate from a University of Massachusetts analysis on a similar bill. Sanders says he would offset that cost with income-based healthcare premiums paid by employers and households. His tax plan, which would raise taxes for the wealthiest Americans, and tax subsidies for healthcare becoming obsolete.
All right, Dr. Campbell, is that a good idea, Medicare for all?
Well, I tell you, Medicare does not work very well in its current form because we can't provide all the care we need. We're very restricted in what we can do, what gets approved, what doesn't. And this is completely unaffordable. And I don't see any way that anything like this without a tax rate of nearly 80% on the wealthiest Americans will work. And then you destroy free enterprise. The American dream is gone.
Right, and we know Bernie Sanders himself doesn't have a problem with that high of tax rate, but hopefully everyday Americans like you and me do. Bernie also compared our healthcare system to the British and how much we spend. He said that they spend so much less than we do. Was that a valid comparison? I mean, the British healthcare system's nationalized, but I don't hear very many good things about it.
You know, what's happened in Great Britain is what will happen ultimately here. Instead of bringing us all to the middle class, we're going to separate America to two Americas. Those that are the very wealthy that can afford any care they want to pay out of pocket for, and then everyone else. That's what you see in Great Britain. We spend more per person in the U.S. than any other industrialized nation. And again, I think part of that is the cost of drugs, research and development, and also the fact that we have to protect ourselves from legal predators. They don't have that in the U.K.
Right, and I certainly hope people recognize what you said, that if a program like Medicare for All was implemented, it would require such an enormously high tax rate on the wealthiest Americans that it would change the entire structure, the entire economic and financial structure of our entire nation. Bernie Sanders wants socialism. He said it himself. This is the first step to it. Dr. Campbell, I appreciate you coming on the show today. Thanks for being here.